community participation. And so if we are in a certain community, we would be able to know if we have, if we're collaborating with, the people who keep the data, with the epidemiologists, with the local government council who have the vital statistics, if we're collaborating as well with the community heads and, the community representatives, we're more able to know where the elderly people are.
Okay.
And that can also help inform us as to where to locate the vaccination points. Would it be ideal to just stay in the health center? Would it be more ideal to go to a more accessible, local government center or area, or maybe even the market square? It could be anywhere where, people, considering that again for elderlies, they may not be mobile.
Right.
Some of them may be wheelchair bound. So are we going to do home visits? I mean, in Nigeria, luckily we have a robust vaccination and immunization, system. We've been doing it for decades. And so we do mobile, we go up and down. So are we going to add that to, the plan for the vaccination, so that for the elderly that cannot come to the centers,
right,
we have plans to take it to them and, meet them and vaccinate them where they are, knowing that they are especially vulnerable.
Okay, I mean, for with the enormous challenges that we do have as a country, knowing that, the number of health workers that we do have is also on the decline as we speak. Now, and you've raised a very vital issue. We need to start thinking of, the elderly that may not be able to come to the health centers or the vaccination points. Now, who should bear this responsibility? Will this be the federal government, the state government, or the local government, who we see as the closest to the people? Sometimes when you get to health centers, you see the elderly being brought in either on the wheelchair, just like you rightly noticed. So at what point do we begin to factor in some of these things that you've identified as a means of getting the vulnerable vaccinated?
All right, so for me, I would say it is not just for one sector of the government or for one group of people.
Okay.
It has to be a collective thing.
Okay.
So the federal level, we have to cooperate at the federal level, because we may be getting the vaccines from the federal level, to the state level, who have the data that we need, to the
Okay.
local government, who know where these elderly people are placed, and to the community leaders, to the health workers who have been involved in previous, immunization campaigns. So it can't be left to, one group of people. It has to be a collaborative effort,
Okay.
so that it can work.
Right.
And this is why, community participation is very, very important, because, for instance, again, if we talk about community participation, we know that there are about 4 levels of community participation.
Okay.
From the beginning, we have the information sharing, where, if you want to have an intervention in a community, you just go and then you just give them, the details of what you want to do, to where you now, consult with them. And in that consultation process, and then you begin to have ideas of an information, maybe that you ordinarily didn't even know from all the other people who you have collaborated with. And then they can even advise us more on where to find the elderly. They can advise us on maybe where would be the best location, to have this immunization spots within the community, so that, there would be compliance, and so that people will come out and people will want to take, and then we can communicate. So there are different levels of community participation. And then we have the decision making, where, we get them involved in, making the decision, we are going to start it on so day, from what time to what time, who is bringing, Baba that lives in so many areas. And then to the level where we now begin to take the action, and we say, okay, on Tuesday, Wednesday, Thursday are the days that we're going to have the immunization done. And so in a nutshell, when we all collaborate, with this different cadre of organizations and of people, then we will have, better uptake, and it will be more successful.
Right. I mean, so we are in the first phase of the 4 phases. At the beginning, we were